Joining us live to discuss is Dr. Vin Gupta, a pulmonologist and NBC News medical analyst. Doctor, thanks for joining us.
Good evening, Joyce. Thanks for having me.
Well, okay, first, what is the AAP's basis for recommending their COVID shots for children? I mean, are kids under the age of 2 at risk?
They are, Joyce, and I have a dialogue with their leadership often, especially given these times. And they're really focused on children, to your point, less than 2 years of age, those children that are higher risk, or that live with an adult that might be higher risk from a medical standpoint or because of age. Very sensible. And that's what the evidence shows, that yes, kids, especially younger kids, less than 2, still have developing immune systems, still can get severe complications from COVID-19. Why wouldn't we prevent that? Or if they have a medically high risk condition like asthma, or if they live with somebody who might have a detrimental side effect if they get exposed to COVID-19, like somebody that's older. This is very sensible, and that's why they diverged for the first time ever from CDC guidance.
And do you think the risk warrants all kids under the age of 2 get this vaccine?
I do, and that's what the AAP believes as well, which is that, and the reason why here is, children less than 2 tend to have, so this is just to clarify, between 6 months and 2 years of age, their immune systems are developing. And so it's not just COVID, it's flu as well. Flu, that recommendation is going to remain unchanged, thankfully, so we don't have a ton of confusion. But whether it's COVID, whether it's flu, RSV, also another virus out there, these are viruses that disproportionately impact those on the extremes of our age groups, so those that are older and those that are younger.
Mm-hmm. It's confusing for parents, and here's why. Because as you know, under Secretary Kennedy, he's a vaccine skeptic. The CDC has reached a totally different conclusion. Kennedy's saying that there is, quote, a lack of any clinical data to support the repeat booster strategy in children. The NIH director called Kennedy's position common sense and good science, and the FDA commissioner said that there is, quote, no evidence that healthy kids need it today. So your reaction to that in terms of what parents are supposed to do, because really these two decisions diverge.
They do, and it's unfortunate because some of the same people that are now in positions of power, the FDA commissioner, the NIH director, didn't necessarily have those strident views before they had their current position. So they had an ability to have some nuance here. So I think there's other factors at play, but for your audience and all the parents out there, really important to keep in mind what the AAP is saying, the American Academy of Pediatrics. They're focused on high-risk children. So those under 2, those with a medical pre-existing condition like asthma, or those living in a multi-generational household where somebody in that family might be high risk. It is de-emphasizing everybody. And they're being responsible. Why there's this divergence, there's the reasons exceed our ability to talk about it, Joyce, just in a quick segment. But the data backs up that hospitalization, severe pneumonia amongst young children especially, still is a worry that's preventable, but it happens at enough of a magnitude 6 years into COVID-19 that it warrants getting immunized, just like we think about flu. Flu, the numbers are high enough that why not avoid the potential complication if you can versus tolerate unnecessary risk? Does that change as children get older, especially if those children are healthy? Let's say you have a 10 or a 14-year-old and they're just completely healthy. Yes, we're not emphasizing that group nearly as much as we're saying, let's focus on those under 2. Let's focus on those with, say, asthma or underlying medical condition, or those living in a multi-generational household.
And then I feel like I would be remiss not to ask you this. The AAP has come under some scrutiny. It's been accused of getting money from Big Pharma. And for some parents, that could be a potential to maybe not trust all of the information. I know that you are always citing science as the reason that vaccines are necessary. I'm just curious what your comments are to that.
The amount of money, and I say this with no conflicts of interest here, I just say this as a clinician, as an Air Force reservist at Joint Base Lewis McChord, as somebody that's trying to do the right thing. The amount of money that gets funded or put towards nonprofit organizations like AAP from pharmaceutical companies, from nonprofits, from philanthropic organizations, it's almost too much to count. Does that mean that they're somehow co-opted or caught by those special interests? No, not at all. And I personally know the president, who I'll be talking to shortly next week. None of those frankly, private sector philanthropic donations in any way impact these white papers or these recommendations. And the suggestion from those that want to draw a link is completely, it's just completely false. And it's unfortunate that those things have to even be talked about.
And then finally, doctor, what advice do you have for doctors and parents and schools as we head into this new school year?
Yeah, there's a lot out there. For doctors, I would say, and one of the questions I get is, if I give something off-label, Joyce, and my wife's a pediatrician, we have this conversation all the time. If I give something off-label that the CDC doesn't recommend, are you at risk from a legal standpoint for doing so? And it's important on hospitals and state departments of health to reassure providers across the spectrum that they will be protected, because there is exposure. There is that concern there. And we have to reassure providers across the country, not just here in Washington State, that you'll be protected for doing evidence-based medicine. For parents out there, go to the American Academy of Pediatrics website, or if for whatever, go to where you trust getting your medical information. I would favor that being your medical provider, not social media, not all the noise out there. Go to your medical provider, have a conversation. If you have questions, or if you're not trusting the information that you're hearing, go to your medical provider and have that conversation. And for schools, it's always important to realize that whatever happens in the information ecosystem, Joyce, to take it with a grain of salt, and to do what to follow State Department of Health guidelines. I really believe we're in a moment right now, Joyce, where we should be following societal guidelines, medical society guidelines like AAP. I'm on the board of directors of the American Lung Association. It's a nonprofit. There's no money there. We're just trying to do the right thing. But all these organizations, the American Lung Association, the American Academy of Pediatrics, puts out guidelines that are evidence-based without conflicts. They're just trying to do the right things, and encourage people to go and check those resources out.
Dr. Vin Gupta, we so appreciate your insight into all of this, especially in this moment, as you said. Thank you so much.
Thank you.